The information expressed in the following podcast is intended for educational purposes only and was created by and belongs solely to Believe Limited and the Flow podcast and does not necessarily reflect the views of our sponsors. Please speak to your healthcare provider before making any medical decisions.
Hi, I'm Jessica, and welcome to Flow. I'm here with Sarah Watson, sex therapist, and we are honoring Bleeding Disorders Awareness Month with a deep dive into vWD with Jess Foley, MD. But first, we all want to know, how's your flow? We start off Flow with a quick check-in to normalize the reality of menstruation. So, to our assembled lovelies, how's your flow?
Dr. Foley, go ahead.
Great. I've just been so excited about this question. I've listened to this podcast, and I will say that my flow, I don't flow anymore. I think that, like many things when it comes to the female body, menstruation is a choice, and I chose to alleviate mine about 15 years ago. So I'm a big IUD fan, specifically the 5-year IUD, and that's my flow.
Yeah, specifically that IUD, because I know we're going to talk more about other kinds of IUDs. And speaking of IUDs, Sarah, how's your
You know I'm not flowing as well, which is lovely. But I'm probably going to ovulate soon, feeling that coming, that I do feel consistently every month. So, but just relaxing over here. No cramps, which is shocking, which is great. I know.
Do the cramps come pre-ovulation or right at ovulation for you?
Both.
Both.
You know, I found that so interesting when I listened to the previous podcast and heard you talk about that. Like, I have no idea when it's coming, what part of the month I'm in. Nothing. I go about my life and have no sense of that.
I can tell which side it's coming from.
Really? That's just so... I mean, isn't the female body just fascinating? I know I'm a hematologist, but I just find it fascinating.
It is.
J. Rich, where are you? Wait, where are you? We need to know where your flow is.
No.
Well, see, I will probably start menstruating during this recording.
Oh, yes, this happens sometimes for us.
It really does. It's in flow. I come to flow
So close.
to flow that way. But, you know, even with IUDs, even if you're not having a menstrual period, you still have a hormonal flow. Yes, no?
Yes, definitely. In fact, the IUD is the easiest method to get pregnant upon discontinuing it because it does not disturb your normal hormonal flow. And it's one of the reasons I love it for my patients is it doesn't have increased blood clot risk. It doesn't affect mood. Some people might still say it does. Everyone's different. Someone's body might be a bit more sensitive, but I know many people, myself included, who got pregnant very fast upon removal of the IUD.
Yes. Everyone is different. That is a good theme for our flow in. We are going to flow on today on Flow. We're going to talk bleeding disorders in camp and horror stories about IUDs. But first, we're going to take a quick break.
This ad is brought to you by von Willebrand factor recombinant.
My name is Nicole, and my deciding factor is making my voice heard. To hear the backstory, drop by Von Vendi, that's vonvendi.com/patient-stories.
And we are back with Jessica Foley, MD, pediatric hematology and oncology. Jess, Sarah, you two go way back.
Yeah.
And we're going to talk about vWD, but I love to know how you two know each other.
It's one of my favorite stories. I would love to hear you tell it, Jess.
Well, I was a pediatric resident, so I was finished with med school and in my training to be a pediatrician. And I had always loved the area of hemophilia. My father was a camp director in hemophilia back in the days, and they had this opportunity to go spend a month at a hemophilia summer camp in place of a normal elective. And I was like, of course, sign me up. I'm a huge camp person. And so I went to this hemophilia summer camp, and Sarah was working there, and we've just been besties ever since.
Yes. And we just got along so well. Yeah, camp, I'm telling you, we've talked about this on the podcast so many times, but camp is just such a connection and connector for so many of us, which is amazing. And especially in my life. So super grateful to have been palling around at Camp Old Eagle.
Camp Old Eagle.
Camp Old Eagle.
It's a great place.
And camp is great, particularly for those who find a reason to come together who don't always find that common ground with those they're around. For example, those who receive a vWD diagnosis.
Right.
Camp might be a place, bleeding disorders camp in particular, where there is that unity and like what you're experiencing, I'm experiencing. And some of our listeners may be experiencing, and whether they know they have it or not, we're in this episode going to deep dive into what vWD is. So Jess, putting you on the spot right away. Dr. Jess.
Oh.
Just casually tell us what this very complex disease is. Thank you.
Yeah.
So vWD stands for von Willebrand Disease. And sometimes I take a little issue with the word disease. What it is it's really that people run decreased levels of a protein called von Willebrand. There's many different types of von Willebrand disease. And sometimes you might have the protein, it just doesn't work as well. And what von Willebrand does is it's really important in all of our clotting that happens in our body, sometimes called all the coagulation factors, to use kind of a fancy word. It works very closely with something called your platelet, which is a cell your body makes, as well as factor VIII. And when someone has bleeding, all of that comes together to really help form a blood clot and stop that bleeding. So when someone is low in von Willebrand, or their von Willebrand doesn't work as well, they definitely can bleed more easily or have an easy bleeding tendency. And a lot of the times, von Willebrand patients, the type of bleeding they have, easy bruising, very common, heavy menstrual bleeding. Like there's some insane statistic that 95% of women with low von Willebrand have heavy menstrual bleeding. However, 70% of them will tell you that their periods are normal. So
right.
Not even people with heavy menstrual bleeding realize that it's heavy because their sister has it like that, their mom has it like that, their grandma has it like that.
Yep.
It's what it's been their whole life. And I hear that time and time and again when I'm talking to women about their menstrual bleeding, is that there's not this realization that that's actually quite abnormal.
And what might those abnormal stats look like that some might think are normal? You know, we talk about it before, but over 7 days, over 6 tablespoons, what sort of things might be a signifier?
And I get it that I haven't had a period about 15 years, except, right before I had my children. But who even knows how many milliliters of blood that they have? Like who can even keep track of that? We use these tools called bleeding assessment tools, but really when I'm talking to people, just asking them some very straightforward questions. I don't like the question, are your periods heavy? Because they're all going to say no. Or many might say yes, but that doesn't really help me. So exactly what you said. Do you bleed longer than 7 to 8 days? And when you are having your heaviest days, like tell me about the heaviest days of your cycle and how often are you needing to change your menstrual product? Are you, and they might say, oh, I like to change it in between every single class. And I then say to them, because some people just don't like a little bit of blood on the pad or a little bit of blood on the tampon, they want to change it. So I say, tell me, if you didn't change it, how many hours would go by before you would be like, oh no, this has hit my underwear? And people they should be able to go 4 hours. They shouldn't be needing to change a product every 2 hours without fear of it hitting their underwear. Another thing I ask is, do you ever double up on products? Do you wear like a pad and a tampon? Do you have to wake up in the middle of the night to change your menstrual product? All of that is stuff that shouldn't really be occurring. Do you pass, like it's normal to pass a little bit of clot, but are you repeatedly passing large clots? And then the other thing, and this is just like my soapbox here, is do you have evidence of iron deficiency or iron deficiency anemia? Because women who menstruate, that you really should not have iron deficiency. That could be that you're menstruating too much and then you need to be on iron replacement, or we need to talk about ways in which to have you not menstruate so much. And iron deficiency is so under-recognized in this country and honestly globally, and is a huge problem for women who menstruate.
How would we recognize iron deficiency? Stay on it.
Yeah.
Wait, no, how would we recognize iron deficiency? Yeah.
So when I see women, I see adolescents with heavy periods is a really common consult that I see. I get a simple complete blood count or CBC on everyone and just look to see what's their hemoglobin. And hemoglobin is how we measure anemia. So a lot of people will tell you, oh yeah, I'm anemic, I should be taking iron. Like so many people say this. And it is because they're having blood loss for women, usually from their periods. And so I'll look at their hemoglobin level. I'll also look at something called a ferritin, which is a measure of their iron stores. I think 30 and above is normal. The computer will tell you like 15 and above, and I take issue with that. And so I think 30 or above is normal. And then there's a couple like other iron markers iron levels that you can look at. But I think those two tests, your hemoglobin level and your ferritin, tell me so much in teenage girls. And then I say to them, because again, menstruation is a choice. Like at every single teenage girl that I meet, I say the same thing to them. And I say, do you know that you don't actually have to have a period? I make a little joke. Are you trying to have a baby right now? No. Well, then you don't need to menstruate. The only people who actually need to menstruate are those who are trying to have a baby. And so let's talk about, you have to go in between every single class, you're changing a pad or tampon. You're missing school maybe because your cramps are so bad. Oh, let's draw some labs. Oh, look at this. Not only are you iron deficient, but you're also anemic. And let's talk about the repercussions of iron deficiency and anemia, because so many times we think about iron as important for making blood, and it's not. Your bone marrow is a sponge. If you are iron deficient and you put iron in your body, that bone marrow will grab it in order to make red blood cells. It is a sponge. It's an iron hog. But the other place that really needs iron is your brain. And when you don't have enough iron, the studies show that you have problems with memory loss. You have problems with standardized tests, the MAPs and the MEPs and the SATs and the ACTs, all of that all the teenagers are trying to take. You have problems just turning in your homework and being successful in school. It has poor athletic performance for the athletes. So, and it can cause IQ changes over time. For women who chronically run iron deficient, they are definitely experiencing IQ loss. And so having a heavy period and not taking appropriate iron supplementation or iron treatment when you need it can be really impactful for these women. And it's incredibly under-recognized. That's my soapbox.
Yes.
I get passionate about this topic.
Appreciate that. And why? No, passion's great. Does it come from a certain place for you, personal experience, or?
I don't think I've ever been personally iron deficient or anemic. I feel that in general, women don't talk about their periods enough. And there is this sense of like, suck it up and deal with it. Or like, this is the way it was for everyone in my family. I'll just deal with it. And providers don't ask about it. They don't ask these questions. They don't dive into what is too heavy of a period or what isn't. I think I have a lot of respect for primary care physicians. They're trying to see patients, though, every 15 minutes. Like, right. If a mom or a teenage girl isn't raising their hand and saying, I don't like this, something's wrong, I don't think the questions necessarily get asked. And I don't blame them. They've got other stuff they have to focus on. But it takes someone really advocating and saying that their period is too heavy. And a lot of people don't do that because there just isn't a conversation about menstruation that happens between patients and with patients and providers. And then when there is a conversation, we under-recognize heavy periods. We under-recognize iron deficiency. And I think that it ends up being kind of, there's an element of sexism at play with that. I listened to a talk recently and I literally like wrote this down because I loved this phrase, that there is a structural sexism that happens surrounding menstruation and iron deficiency. Iron deficiency affects women more predominantly, causes dramatic issues, things people have to live with for the rest of their lives. It's not treated, it's not recognized, and then not treated. And it's kind of like, I mean, how many of your friends say, oh yeah, I'm a little anemic, I should be on iron? Like everyone.
Yes,
this is a
all the
chronic
time.
Disease. It's a big deal. If people were like, oh, I'm a little diabetic, I should be on my insulin. People would take that more seriously.
Right.
You know, so it's just amazing to me how many times I get seeing a girl in consult, and then I get talking to the mom about, no, you really should be on your iron. And if you hate taking iron, maybe you need to think about not having such heavy periods and ways that you can get around, that you can mitigate that.
Yes.
Yeah.
It's a lot.
Under-recognized in the sexism, and also this weird self-inflicted self-neglect, it's really fine that things aren't fine thing that might be a result of years of patriarchal propaganda. But here we are. So now
You read my mind.
I like that term. I like that term.
I was like, where'd that come from?
So now we have unrecognized real problems that also have real solutions, but we're missing this link of getting the solution.
Yeah.
We're missing the link of getting diagnosis quite often. And
Right.
so some of that is the sexism and some of it is the lack of research, why von Willebrand's factor deficiency is so hard to diagnose. Even why it's hard to diagnose seems to be a mystery. Or could you help shine some light on why it's so hard?
It is really hard to diagnose. And many of my hematology colleagues, we'll say, we'll groan about it. Like, oh, would you call this one? Would you not? And I think there's cases where it's very clear cut. So there's a couple different things that people will order when they're looking up a patient for von Willebrand's. They'll order a von Willebrand's antigen, which is just like the protein level. They'll order a factor VIII activity because people who are very low von Willebrand's, they're going to have low factor VIII as well because those two kind of travel around together. And then they're going to measure something called a von Willebrand's activity. And there's a couple different ways that that's measured. The historic test was called the ristocetin cofactor, which it's kind of a mouthful. I don't like it as well as a newer test called a GP1BM activity, which is also a mouthful. But so regardless.
Sounds more Star Trekian or something.
Very Star Trekian. Regardless, it really takes kind of ordering these three different things. In addition to, if you really suspect von Willebrand's, then you're diving a little deeper and looking at the structure of the protein. But I think from a basic standpoint, a basic screening would be to order like these three different tests. When people have low von Willebrand's, and it's probably a normal is like 50 and above. When people are less than 30, it is really easy because that is clear cut. A lot of people fall into this range of 30 to 50. And people will say, is that really true von Willebrand's? I love, there's this new term out, but kind of, this is just someone who has low von Willebrand's levels. And so we should be aware of that. And the next most important question is, do they bleed? To be honest, someone who comes to me and says that they had a tonsillectomy and they had horrible bleeding, the next day their ENT had to take them back and do cautery or whatever, it is more helpful to me in diagnosing a patient with von Willebrand's than the blood test. And the bleeding is just such a huge component of it. So you really have to, do they bruise easily? Do they have nosebleeds? What are their menses like? What's their menstruation like? A lot of kids haven't had bleeding challenges. They haven't had their wisdom teeth out, their tonsils out, needed a surgery. So with kids, sometimes I'm seeing these levels that fall into this lower range. And I'm saying, I want to follow you. I want to see you back. I want to see what happens when you hit your menses as you get older. And so some of it is just having an awareness that it can be tricky to diagnose. And so it's really important to know how the patient bleeds.
Because you can have bruising and not bleeding and all of that, right? So that's interesting.
Do you have bleeding symptoms? If you run a level of 45 and you just screened positive on my menstruation questions, I'm going to think of you as someone who has von Willebrand disease, or someone with low von Willebrand levels who has bleeding. I'm going to want to follow you. If a surgeon calls me and says they want to do a spine surgery on you, I'm going to want to know about that and be involved in that. And sometimes I also feel a little bit like this diagnosis, it's an evolving thing, and there's new guidelines out every few years, and those have been very helpful. There's been some wonderful talks at our big national meetings, like the American Society of Hematology met in December of 2022, and there was 3 incredible physicians who got up and gave this great talk about the diagnosis of von Willebrand's and the under-recognition of heavy menstrual bleeding. And I just wanted to stand up and applause because it's being talked about. So I have a lot of hope going forward in this area, but I think that if someone, I think it's most important to know for people. I would love to just say to people, what you experience with your periods, it matters. And I wish people had more recognition of heavy menstrual bleeding, and then would go out and get tested for von Willebrand's. But ultimately, maybe they fall into this gray area. No one's quite sure that they have von Willebrand's. To be honest, the treatment for heavy menstrual bleeding, whether you have von Willebrand's or whether you don't, is still going to be monitoring for iron deficiency anemia, having discussions about how to make these periods lighter, whether it's OCPs, depot shots, the Mirena IUD, which I think is God's gift to women.
Yes, it is.
If
yes,
men had periods, I'm pretty sure they'd all get IUDs. I
Yeah.
don't understand this. Barter yourself once a month with these 8D periods, miss school for 2 days, anemia, chronic iron deficiency. It just blows my mind that the teenage girls live with this. I will continue on my soapbox. There was a study that came out about the quality of life for patients with von Willebrands. And women with von Willebrands had a lower quality of life than men. And also teenagers with von Willebrands had some of the lowest indicators of quality of life. In fact, when they looked, the study was in bleeding disorders in general, teenage girls with von Willebrands, their quality of life was similar to men who had severe hemophilia and HIV.
Oh my God, and I totally believe it. That makes so much sense.
So do I. Like, you sit there and talk to them and ask them about their periods. And if they're willing to talk to you, if they trust you and are willing to talk about it, many are just telling these stories of what day in and day out life is like. And my heart is just going out to them. And their moms are sitting there going, that's how it was like for me until I finally had a hysterectomy when I was done having kids. Yeah. It's just so under-recognized.
The acceptance of it is an issue. The acceptance of it as normal. You want to normalize the conversation, not normalize the acceptance of menorrhagia and heavy periods. So once you are diagnosed, knowing that you're up against the unknowns, how can a patient best talk to their provider team, to other providers? How can they best advocate for themselves? Is it about just becoming more medically literate?
If someone gets diagnosed with von Willebrand disease, if they're a pediatric patient, they're seeing a pediatric hematologist is my hope. I know a little less in the adult world. I would hope they're also seeing an adult hematologist. And Sarah can probably talk a lot about experiences with adult hematologists. I think it's variable. And I think seeing a hematologist who kind of specializes in coagulation disorders, in bleeding disorders can be really helpful too. If you're seeing a hematologist who's got a lot of oncology patients they're trying to manage, their heart might be in it, but they just might not it maybe be as up to date on the literature and what the best management is. So I think seeing a hematologist is important. And if people don't know, if they've gotten diagnosed and they don't know who they should see, I think reaching out to your local hemophilia treatment center, because my team at my hemophilia treatment center would tell you who to go see. And I'm sure most hemophilia treatment centers would do that. Then in Michigan, we have the Hemophilia Foundation of Michigan, which is generally helpful for everyone with bleeding disorders. I will say, I think hemophilia gets more funding than von Willebrand's does. It gets more recognition than von Willebrand's does. Von Willebrand's affects more people and causes probably the number one chronic disease globally, which is iron deficiency anemia. But hemophilia gets more of the funds and the recognition. But the hemophilia foundations out there are also able to assist patients with von Willebrand's. Maybe they need a name change. So, and I think when I talk to people who have von Willebrand's, I say there's not a pill I'm going to give you every day to just make your von Willebrand's levels higher. We need to recognize you have an easy bleeding tendency. So let's talk about bleeding symptoms you're having right now. Is it easy? Is it frequent nosebleeds? Is it heavy menses? It always is. Let's talk about your heavy menses. Let's get you tied in with OBGYN. And I'm very specific. There's amazing OBGYNs out there, but these are teenage girls we're talking about. Most of them haven't had sexual intercourse. Hopefully, definitely haven't had babies, so they haven't had dilation of the cervix, because one thing that is really helpful for heavy menstrual bleeding in teenagers is IUDs, intrauterine devices. And teenage girls are just terrified of them when you start mentioning it has to get inserted into the uterus. So it's been very helpful for me. When I came into this about 10 years ago, I partnered with an OBGYN in my town, and I basically said, I need someone who I can refer teenage girls to who will get really good at placing IUDs in teenage girls, because there are amazing OBGYNs out there who I love dearly. They just don't see hundreds of teenage girls for IUD placement. So it's a skill, like any procedure, it's a skill. And so I have someone I work with, and she has she offers like a Valium or an Ativan at the time of IUD placement, which I'll argue isn't just for teenage girls who maybe haven't had sex or haven't had babies. I think anyone who's nervous about an IUD placement could benefit from a Valium or an Ativan. And if you're in the Grand Rapids area, I know the OBGYN will help you with that. Otherwise, call your HTC.
Hello.
And for some girls, they need it placed under sedation, and she makes that happen. So finding the people that you're going to work with, so I can send my patients to the person who has the most experience in women and girls with bleeding disorders. And a lot of times, I send my patient, and then the mom goes, and the aunt goes, and the 25-year-old cousin I don't see goes. My OB colleague has said, she's like, I have quite the practice of women and girls with bleeding disorders right now. And she never went into this thinking she would. She just kind of was willing to see teenagers is how it started. So asking those, I think contacting your HTC, your local hemophilia treatment center, even if they don't follow you as a patient, and saying, who would you recommend for OBGYN care? I have a von Willebrand's diagnosis. I have heavy menses. I want to talk to an OBGYN, and getting those referrals and names from them. There's a story that I like to tell probably about 3 times a week to the teenagers who I'm meeting, and I'm talking about Mirena intrauterine devices and all it can do and I will just go into a little bit of the mechanics there. The Mirena has a low amount of the hormone progesterone in it. It gets inserted into the uterus, and then it secretes the progesterone and thins the uterine lining. It does not affect the hormones in the body. So every month, your own hormones say to your uterus, build up a thick lining, get ready for the embryo to arrive. And your uterus might think it's doing it, but the IUD's there, and so it keeps it from building that lining up. And then your hormones then say, all right, go ahead. No embryo arrived. Shed the lining. And the uterus might think it's shedding the lining, which is why some people still have cramps with their IUDs. And it goes to shed the lining, but there just is no lining there. So in the vast majority of women who get IUDs placed, periods go down to maybe a few days of spotting once a month, or in my case, disappear completely. And so when I talk to women and girls with bleeding disorders, I tell them how this IUD works. And then I say, it's good for 5 years. I think actually now indications are pushing to 6 or 7. I still only say 5. I let the OBGYNs be the experts on the IUDs. And it's good for birth control during that time, not prevention of sexually transmitted infections. You still need to use condoms. I say that too. But please, when you go talk to OBGYNs, know, because I had a case of someone who had heavy periods because she has an easy bleeding tendency. And I talked up the IUD like it was the best thing ever. And she went to her OBGYN and got the IUD, and then later said, WTF, my periods are horrendous. Why did you recommend this? I mean, I got really excited when they offered 10 years of birth control. And I'm like, oh, you got the wrong IUD. So there is a wrong IUD. And I tell this story 3 times a week. And I keep that person nameless who this happened to.
But we don't have to.
Is this the copper story? Is this the famous dun 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 copper IUD story?
Well, let me add a little zhuzh to this story. So this conversation happened on a girls' weekend where we're just hanging out and having conversations about things that close friends do, bleeding, relationships, and conversation was like, why are you even having a period? Blah, blah, blah. Here comes the hype from Foley. It's so great. And then I almost die because, no, not really, but it was, what the hell is happening? And then it was removed, and that's fun, too. And then got the Mirena. And then I was like, okay, I can be on this team of IUD. And now I tell all of my clients myself that story about how horrendous the non-hormonal IUD can be. But yeah, we talk about it all the time. So interesting that we both talk to your patients and my clients about my lovely bleeding experiences.
And I think one thing that is so disappointing to me as a provider in that story is like, clearly you didn't walk into a drugstore and grab an IUD off the shelf. Like,
no.
You have to talk to a healthcare provider about that who should have seen that you have a bleeding disorder, an easy bleeding tendency, and said, "Ooh, I know 10 years of birth control sounds awesome, but this one isn't a good choice for you."
Right.
And I have my theories. I think sometimes even the most well-meaning providers, if you just don't see as like a lot of patients with it, they can kind of maybe forget that or have that not at their forefront. I also think that there is the failure to recognize bleeding in hemophilia carriers, and that is a different podcast topic.
That is. I know. It sure is.
It's a different soapbox.
Yes. Yes. But it's just how to advocate for it. Like, and that's, I think that was part of learning how to advocate for myself, was that whole experience. So, hate that it happened, but I know, but it's okay now.
Well, we're here.
Yeah.
But before it's okay now. But so we know that happy ending. So can we, for a moment, go into the copper story of what was so extreme? Like, what was the wrong when copper's in there? What happened? So people know never to do it again. This is the tale. Like,
never again. Right. There's no hormones, right, Jess? Like, there's nothing that's going to stop that buildup.
Can I be honest? Like, so I'm not an OBGYN. I have a love of the Mirena IUD. I have a hatred of the copper IUD because it makes periods heavier. I don't exactly know why, and I should. Okay. I will make a note and look it up afterwards because I don't place IUDs myself. You would not want me to place your IUD.
No, we wouldn't.
I'm a big fan. I just hype them up. But it does. It makes it, the way it works, the way it disrupts that uterine lining is not by thinning it, like I described with the Mirena. And so it's great for birth control, but some people I don't think have had periods change, like get heavier. But I think if you have a bleeding disorder, and there's this risk of that periods could be heavier, that definitely could happen to you. And so, I do a big warning against it. And this is another reason why, and again, I don't think it was ill intent. I think someone just wasn't very educated, and we all have lots of things that we're trying to deal with in medicine, and everyone's not as well informed about certain things as other things. But it's so, I really say to my families, if you want, I will refer you to my person. Because I just know that that's not going to happen to them.
Right. Well, I think too with that, just kind of remembering that experience, that practice now knows all about women with bleeding disorders, because not only did I continue to go there, did my sister, who is a carrier, and then there was also, and I don't, obviously HIPAA, don't know, but there was another woman that had a bleeding disorder that was also at that practice. So, and we all delivered babies through that practice, so they're very well aware now. So thank goodness. That was, again, good, terrible thing to go through, but hopefully we're helping other people. So
hopefully helping other people.
Mm-hmm.
How long did you have it in, Sarah?
Oh God, not long. Maybe a couple months. I was like, what is happening? I'd have to look through my chart. That's a great question. Maybe 3 months. Because I was like, I'll give it a couple, like it'll adjust. No. And then we had a conversation. I was like, what is happening to me?
And you were like, this is a horrible idea. I can't believe you recommended this to me. And I'm like, oh my God, I feel horrible. And then you were talking and venting about it and how your periods were so much heavier and they were already heavy and how could this happen? And I mean, 10 years of birth control sounds great. And I had this moment of being like,
oh, you got I remember. Yep. But I don't remember how long I kept that in. I think I probably immediately made an appointment after that phone call, being like, get this out of me.
I mean, I'm impressed you didn't just take it out yourself.
I mean, yeah. Just get up in there, pull those strings.
Can we talk about the anatomy for a moment? Like, the reason it's so delicate, right, is the cervix. I had explained to me once, is like trying to imagine this thin, paper thin, like the mass of it is paper thin, and it makes a tiny, tiny little circle, and you have to go in through that.
So the way
I know
I
everything's
describe
stretch it, yeah.
I usually like to pull out. I now have a diagram, or a handout that has an illustration on it, because I always tell my patients, I'm a doctor, not an artist. And then I proceed to draw for them a vagina, and at the top of your vagina, I say is your cervix, and it looks a little bit like if you made a fist. See this close? If you make a fist and look at your fist head on, there's a closed opening to your cervix, and so when you go to an OB, I always make the difference between an IUD, so a tampon. I always say to my patients to use pads or tampons. Are you familiar with tampons? Most of them are familiar with tampons. Tampon sits right in the vagina. The string hangs outside of the vagina. If you stood in front of a mirror, you'd see the string. With an IUD, the OBGYN, or I should also say family medicine physicians place them as well.
Right.
Dilates the cervix ever so slightly. And I draw what an IUD looks like, or I have my little picture, and inserts it in there and then into your uterus, because beyond your cervix is your uterus. And then the strings of the IUD hang just outside the cervix instead of hanging outside of your vagina. So I tell patients, you're not going to see these strings. If you wanted to, you could take like 2 fingers and reach up into the top of your vagina and probably feel those strings. Not a lot of teenage girls feel inclined to do that, but you could. And I even know some adult women who, when they decided they wanted to get pregnant, reached up and pulled their own IUD out. I did not do that with mine. That's a little bit more badass than I consider myself to be. But you could.
Right.
Ouch.
Yeah, and it is, at the time to get it removed, for most women, I will say, there's always stuff that happens, but for most women, they go to the OBGYN. The OBGYN gently pulls on those strings. The IUD comes out. And again, because it's your body's own hormones, that uterine lining starts building up and you could be pregnant, within days.
Yes.
I'll just close on this podcast. I think it took me 10 days to get pregnant after my first IUD was removed.
Yes.
Which means sperm reached when ovulation was happening, and all that timing was also occurring.
All of that timing.
Certain days.
I didn't know that, but that's how I did.
Right, because you weren't feeling the ovulation. Well, and let's also say, and I think I've shared it on the podcast before, and if I haven't, but my strings on one of my IUDs did wrap around the IUD itself, and I had to have it removed in a different fashion where there was more dilation required. And
and I hope you got some Valium or Ativan with that.
Don't think so.
I was gonna say, weren't you not able to at one point? Wasn't that an issue?
Oh yeah. So then we also talked. So I have a newish. I got it this summer. I think we talked about it before. No meds were offered. I asked, and she said no for placement at all, and it was terrible.
Because pain is so constantly dismissed,
right?
Or not validated.
Pain is so dismissed in women.
But that was a different provider than the one I was speaking about before, who understands my bleeding disorder. So I will not be going back to her. I will be going to someone else. I'll be driving an hour away to go see another physician that I love.
Come see my person.
Yeah, we'll make a weekend of it. It'll be great.
You should have her on the podcast sometime. I'm going to tell her about this podcast.
Oh, we would love that.
She would be so good.
We would love that.
So other things that I really like to tell all my teenage girls when I see them, teenage girls and young adults, is that if you're having a period, you should be taking a multivitamin with iron. Every woman or girl who menstruates, or biological female who menstruates, should be on a multivitamin with iron if they're having a period. And a lot of people want to take the gummy multivitamins. I would too. I love gummies. A lot of gummy companies took the iron out. So you're going to have to flip the label over and make sure that it actually says it contains iron. Honestly, a great women's multivitamin usually almost always contains iron. And I would love it if we were all on them, and I should take mine too. So that's something I always tell teenage girls who menstruate. And a lot of people, as we talk about, the other thing I like to tell teenage girls too is when it comes to blood donation. So a lot of people find out they're anemic. When you go donate blood and they prick your finger and then tell you can't donate blood, that's because you're anemic. And you're probably anemic because you're menstruating and you're low in iron, therefore depriving your body of making red blood cells and depriving your brain. That should be a trigger to go talk to your primary doctor about that and get labs drawn and figure that out. But instead, we have these blood drives that come to high schools, and who stands up to donate blood?
Girls, right?
It's these altruistic women. It's these altruistic girls who are menstruating. And I would love to say to blood drives, please, if women are menstruating, please don't
ask.
Have them donate blood. Men, when they're post-pubertal men, so men who've gone through puberty, run a hemoglobin usually in the range of 14 or higher. Women are 12 to 13. So take the men. Go take the blood from the men.
Yes.
Blood donation soapbox. And then the final thing, I have a lot of girls that I meet, and even though their periods are really heavy, they don't maybe their moms don't want them on hormones. Maybe they don't like either the idea of birth control pills or the IUD or anything. And it's a choice. It's a choice if you would like to do something to make your periods better. And I want to empower you to make that choice. But it's also fine to kind of live with your heavy period if you'd like to. But then you need to be on iron supplementation and under the care of your doctor to make sure that you don't develop iron deficiency, or it's the next step of iron deficiency anemia. So I like to tell everyone, I'm not going to make you do anything. It is a choice, but you do need to treat your iron deficiency if you're going to choose to not address
blood donation.
Yes.
I want more, but blood donation in vampires. Please take the male-bodied people first. Yes, take them.
Take the boys. Take the boys.
Yes.
I mean, don't turn them.
Take them.
I don't know about that much about vampires, but what else? What other soapboxes do you like, Jess? Because I'd like to provide you another stage if possible. Like, your passion is invigorating. Yeah,
it's amazing.
I think that I love. I mean, I also do oncology. I have a big passion for leukemia. I realize that this is not the form. But women and girls with heavy menses, women and girls with bleeding disorders, hemophilia carriers who have been told for decades that, oh, you just carry the gene to potentially have a son with severe hemophilia, but you won't actually have bleeding yourself. That's a big passion of mine. Like, getting rid of that misconception. I have med students who come to my hemophilia clinic, and hemophilia, it's X-linked. So my severe hemophilia clinic are males. And a med student once said to me, you talk a lot about IUDs for a clinic that's all boys. And I'm like, yeah, because I'm talking to the moms. I ask every single mom, first, do they know if they're a carrier? We figure that out for them. Sometimes it's a spontaneous mutation in their son. They may not be a carrier. If they are a carrier, then I ask them about their bleeding symptoms, specifically about their periods. And every one of my hemophilia clinics, I talk about IUDs, and I think I do. And I talk about the copper IUD and how much I hate it. So I just think we ask the questions. This is just so true about everything in life. Like, when you ask people, when you take a second and ask people the questions and ask them to talk about themselves, that they'll talk and they'll tell you these stories, and they'll tell you their experience and their stories. And I think that can be therapeutic, but I think, I'm also helping them get resources and find care.
Yeah, if a mom is hooked up with you and she's getting that information from you and she's getting a referral, and that's great. But what about the random woman who's maybe thinking she got this information probably from maybe me, where I'm sending, because we're talking about her period, because she's coming to see me too, because we're talking about sex, but the period's really bad. But I'm going to say, go first. We got to start, with your primary care. What should they be saying and asking for?
Yeah, I think that saying, gosh, I have really heavy periods and I would like to be tested for an easy bleeding tendency. And primary care doctors can do a basic screening. I have pediatricians who call us every day saying, I have this 13-year-old with heavy periods. What should I screen them for? And we're really happy to tell you. And I'm so glad you just said this to me, because I just have like an afterthought too that I want to add, which is they get screened for they have heavy periods. So they have iron deficiency anemia, like I just told you. Von Willebrand's, the von Willebrand protein, and one of the other reasons it's tricky to diagnose is it increases when you're stressed out.
Right.
So if you hate getting your blood drawn, if the phlebotomist has to poke you 2 or 3 times, I will say to parents, like, when you get these levels drawn, if they don't get it on the first poke, don't do the second poke, because the kid's going to get so stressed out. Your body increases the levels at times of stress, and then they look normal and they're really not. The other situation where you're stressed out is if you have iron deficiency anemia. So your body is stressed and it's increased your von Willebrand's levels. So lots of women with iron deficiency anemia go get tested for bleeding disorders, and someone will send a von Willebrand's panel and it comes back normal. And you really need to fix their anemia first before you can test for von Willebrand's. And I mean, I say that all this time. So I think just knowing and advocating for yourself that you want to get tested, keeping asking the questions, finding someone that's listening to you and not dismissing your periods. Right. Yeah. And if you don't know who you should go to, if you're like, gosh, I just feel like the person I saw didn't quite know about testing for bleeding disorders, call a hemophilia treatment center. Yeah. And they'll tell you who to go see.
Right. HTCs.
So
yes,
helpful.
the HTCs.
The HTCs. You're opening all my soapboxes. I think. I feel like I said them all.
Sure.
Okay.
Yes,
I'm sure there'll be one later.
Please come back to flow with us more. Maybe we should do one specifically on puberty, both personal and professional experience as a pediatrician, to talk about that era when patients move on. Like when they age, does vWD change with age? What happens next? But also what happens during puberty emotionally for so many girls and menstruators. We could get into that next time.
Oh, yeah. I would love to hear that podcast. I don't think I need to learn about that.
No, I've seen Turning Red. That's my
perfect
main understanding of. Thank goodness for Pixar. Oh, and wait, I
love
got my period. Just kidding. But it's very close.
That would have been amazing.
Yeah.
Keep that in there.
I do appreciate flowing hormonally with you both.
This has been great. I thank you both for doing this and for getting this information out there to people.
Oh, thanks for coming on with us. It's so fun to have you on.
That's it for now, but we'll be back to talk period pain and other extreme menstruation. Oh, and won't you follow our new TikTok at How's Your Flow? And if you're still listening, would it be in flow for you to go ahead and leave us a review? Just wherever you get your podcasts, just put some stars there. Thanks so much. We appreciate you. Flow is produced by Bloodstream Media and edited by Kay Vermeil. Shout out to Flow's creative director Amy Board and hosts Jessica Richmond and Sarah Watson. New episodes are available the second Thursday of each month.
Hey, that's the day after I start menstruating.